Health Science 100 with Professor Woods. Welcome back to Chapter 2, Part 2.
So, what are some of the mood disorders? Some of the things that are occurring to our emotional health. The biggest one, of course, is major depression. Major depression occurs very frequently, and major depression is something that needs treatment. There are bipolar disorders, seasonal affective disorders. Sometimes people suffer from lack of sunlight in the summer and feel depressed in the wintertime. That's a seasonal affective disorder. After giving birth, mothers often suffer from postpartum depression with huge hormonal changes that are occurring after pregnancy. These are all serious conditions that should be treated by medical professionals. What are some of the symptoms of major depression? Sadness, loss of motivation, preoccupation with failure, difficulty concentrating, loss of sex drive, fatigue, loss of energy, sleeping either too much or too little, agitation, withdrawing from social networks, altered appetite, sometimes loss of weight or the gain of weight in a short amount of time, and recurring thoughts that life is difficult to manage, difficult to cope with, and sometimes that will lead to thoughts of self-harm. These are all signs of major depression, serious disease that needs treatment. The sooner someone can get treatment, the quicker they can get back on the road to health. I'm not going to talk too much about some of the other forms of depression here, bipolar disorder or seasonal affective disorder or persistent depressive disorder. But you can read about those in your textbook. There are also anxiety disorders, again, very frequent, probably the next most common after major depression. Anxiety disorders are characterized by feelings of worry and feelings that somebody is constantly under threat. It's one of the biggest mental health problems in the United States. It affects a huge number of people every year. Generalized anxiety disorder is a disorder where people are so anxious that they are unable to cope with society. And these are disorders that need treatment. There are panic disorders. Sometimes situations can trigger panic attacks. Sometimes there are phobic disorders where people are afraid of specific objects or have irrational fears. I tend to be claustrophobic, which means I don't like to be in enclosed spaces. It stems from a childhood accident where I was trapped. But most people suffer from some kind of anxiety in particular situations, and that's okay. It becomes a disorder when that negatively affects your life, and at that stage you will need to get treatment. Obsessive compulsive disorders, people can be compelled to perform rituals over and over again, and oftentimes after traumatic events, and those events can be disasters or accidents, but even smaller traumatic events, loss of a loved one. These are traumatic events in our lives, and they can cause post-traumatic stress disorder. Very serious condition that needs treatment. Okay, there are also personality disorders. You may see these from time to time. Paranoid personality disorder, where people have pervasive suspicion and mistrust of other people. It makes social interactions very difficult. Narcissistic personality disorder, it's an exaggerated sense of self-importance and tendency to be self-absorbed. Relatively rare disorder. Antisocial personality disorders, people that display patterns where they would like to manipulate others and take advantage of others in criminal fashion. Be aware of that disorder. And borderline personality disorders, sometimes people are their personality is dominated by impulsiveness, risky behaviors, addictive behaviors, things like gambling, illicit drug use, just reckless acts. Get those people help, save their life. And then there are other chemical imbalances in the brain, like schizophrenia, mental illness that is characterized by irrational behavior. It's often seen with auditory or visual hallucinations, and it does affect about 1% of the United States, the population in the United States. People with schizophrenia need medical attention. And this is the difference between a normal brain and a schizophrenic brain. You can see that this area at the bottom here, which is bright red, showing massive activity, which is not how the brain should be functioning. Suicide risk. Something I just want to bring to your attention. Be aware that there may be triggers for people that are suffering from major depression or major anxiety. Things like recent loss, grief, can be triggers for suicidal behaviors or self-harm behaviors in people that are suffering depression. If you notice that a person is depressed and suddenly has changes in personality, or is expressing self-hatred or ideologies of self-harm, not sleeping, maybe making indirect or even direct statements about harming themselves or others, making final preparations for self-harm, or preoccupied with death and themes like that, get them help straight away. File a cares report, talk to counseling, make sure that person is safe, get them the help that they need to be safe, and prevent self-harm. Here I give you the number for suicide prevention, but there are also the counseling numbers for the college that you should be aware of. They can be found on the help page through the help window from the navigation page in this course. Yeah, furthermore, preventing suicide, monitor people, take threats seriously, let people know that you care about them. Definitely ask someone directly, are you contemplating self-harm? Find out. And if they say yes, get them help straight away. And if you can, come up with sort of alternatives to help them through their grief. But the bottom line is always seek mental health professional. Seek some professional help. The slide there is the public safety phone number, the National Prevention Suicide Prevention Lifeline text number and phone number. Do not hesitate to contact people to make sure your friends, your family are safe. When someone is receiving professional help, there are some typical treatment modes. Psychodynamic therapy focuses on the roots of emotional suffering. Sometimes there's interpersonal therapy, which focuses on social roles and relationships to support people who are suffering. There is cognitive therapy, which can impact our thoughts and our ideas, our feelings and our behaviors, to get those positive. And there are very effective pharmacological treatments for people who are suffering from many psychological disorders. There is stigma associated with pharmacological treatment. There should not be. The brain is like any other part of the human body. At times, the brain's chemistry will be out of alignment, and pharmacological treatment is available to help your brain achieve a healthier chemical balance, achieve a healthier balance so you can be healthier and prevent any kinds of situations that will be deleterious or negative for your long-term health. What else? We've talked about psychological support, we've talked about pharmacological help with things like antidepressants, but there are other things that help people. Massage treatment, gardening groups, being out in green spaces helps a lot of people. Nutrition support. Oftentimes our brain chemistry suffers because we're not eating a healthy diet. Yoga, Tai Chi, sometimes slowing down and being mindful in those kinds of spaces can help people psychologically. Meditation and relaxation will help people often, and exercise is a huge benefit to most people in terms of their psychological health. Medical professionals that can help as psychiatrists, psychologists, clinical psychiatric and social workers. Here at the school we have counselors. They can put you in touch with psychoanalysts or other qualified professionals, and they can all help with your psychological health. So what do we need to summarize here to remain positive? PERMA, it's an acronym we can use here to think about how to flourish as human beings psychologically. Positive emotions, engagement with society, work on our relationships. They can be small and light, or deep and meaningful. Both have value. Seek out meaning in your life, spiritually speaking, and reward yourself for your many, many accomplishments. Happy people know how to practice positive, healthy habits. Healthy people tend to be mindful, living and enjoying each moment. Healthy people tend to have rich relationships and empathy towards others. They are resilient and resourceful and feel in control of their lives. And healthy, happy people are competent and unafraid of learning new skills, stepping forward, having high self-esteem, having high self-efficacy, believing that they can do things. You can all have these skills and be happy and psychologically healthy. So yeah, develop support groups from friends and family, complete tasks, do my homework, reward yourself when you do my homework, form realistic expectations. In my class, a realistic expectation is getting an A. How do you get an A? You hand in all your work on time. One step at a time, one piece of work at a time. Take time for yourself, be mindful. Do one thing at a time and spend a little bit of time appreciating yourself. Maintain your physical health, get out there, exercise, whatever level that is for you. Just do a little bit of exercise every day and you'll feel better about yourself. If you're struggling, seek help immediately. If you see somebody else struggling, get them help immediately. Contact me. I will put you in touch with people that can provide you help. And sleep, please. Students sometimes forget this one simple thing. You need to sleep. If you want to learn, you need to sleep. The time when memories are implanted in your brain is not when you're reading the textbook. It's afterwards when you're asleep and your brain is processing all of those thoughts that they've come up with during the day. So sleep to learn.